strive for example, we strive for healthy people because healthy people result in a healthy nation. But I need some help in order to do that. Oh, hello, Bemis.
Hello, Mr. Sanger.
Perfect timing, Bemis. I need some help.
What kind of help I can give?
I need a team of 5 qualified professionals.
Oh, I have 5 professionals you need.
It's fine.
Hello, ladies and gentlemen. Let me first of all introduce our topic. We have decided to make a presentation on the healthcare system of Kyrgyz Republic. And the importance of our topic is that we have decided to implement the universal healthcare system, which is widely used in most developed countries. We have decided to use exactly this system because people in Kyrgyzstan prefer using public sector, public hospitals. And if we implement this system in Kyrgyzstan, they're going to get really bright results in the future.
So let's start. Minister of Health is responsible for healthcare sector in Kyrgyzstan. So according to our research, its organizational structure consists of 6 branches, such as Medical Science and Education, Scientific Research Institute, the Department of Drug Supply, the Department of State Sanitary and Epidemiological Surveillance, the Mandatory Health Insurance Fund, and the last one, the Republican Health Facilities. So we did a survey, and out of 150 people sampled, that 66% of people prefer public sector to private one. So then, according to the survey, then we found out.
We found out to be in the public sector, actually research public sector. When it comes to the public sector, we have 6 branches, which is TSS centers, health promotional services. Also, there is a Republican Center for Quarantine and Dangerous Infections, NGO Prophylactic, Department of State Sanitary, and of course, last but not least, Republican Aid Station. Well, one of the attempts to actually endure the human resource management in healthcare sector is DENSOL program. It's a reform which started out in 2012 and going on in 2016, which aiming at improving the whole quality of healthcare. So, before of that, there was Manas and Manas Talami, which were also implemented.
So, according to dental reform, there are several problems. The first one is uneven distribution of medical staff across the country.
So, but here was the thing. Our research showed us that there is a possibility that insufficient numbers of workers is a problem. But as you can see here in the graph, that increasing numbers of workers show that there is no such a thing. But if we go a different way, we see here in geographical distribution, there is such thing as uneven between the physicians of our city and Bishkek city. There are more physicians in our city and Bishkek city than any other regions, which imply that a lot of people need to go to the big centers as Bishkek and Osh to get actual normal treatment.
So then we did the research and found out that the actual cause for this problem was the low level of social life in rural places, as it discourages and demotivates young physicians to work and stay in rural places.
Well, when it comes to the second problem was the poor sanitary and epidemiological activities, which are a little bit cause for it.
And cause for it was inadequate funding and no control systems. So there are not enough budgets to maintain these services. The next
When it
problem
comes to
was,
the problem, third is quality of medical services. Cause for it?
and cause for it was low level of wages and also no lack of modern equipment that also demotivates or no, it doesn't give normal quality service for people. And according to the survey, we found out that standard wages for physicians and nurses are very low. So that so in order to solve this problem, we suggest government to structure the budget for healthcare sector at first to increase it and then allocate it well.
In order to solve the problems with budget, we have to use the universal healthcare system. Universal healthcare system is a coverage for all citizens of all nations. In other words, the universal coverage of healthcare means that means that everyone in the population will get access for appropriate, promotive, preventive, curative, and rehabilitative healthcare then needed and on affordable cost.
So there are several ways to implement this system. The first one is a government-funded tax-based system. The second one is the government-funded fee system. The third one is a health insurance system, which is funded by the government, citizens, or some mixture. And the last one is the decentralized system, which mostly works for the private. Well, in most developed countries, they use the last one, but we would like to use the third one. So here you see the map of all countries using the universal healthcare system. So, here, which countries use the universal
They
healthcare
are
system?
Canada, Argentina, Brazil, Japan, Australia, New Zealand, France, Great Britain, Mongolia, Saudi Arabia, Greenland. But we decided to take the Kazakhstan in order to make a better comparison with Kyrgyzstan because it's a developing country and also neighboring country.
So the Republic of Kazakhstan is one of the former countries of the Soviet Union and also now a member of the Commonwealth of Independent States. It's also the active promoter of the universal healthcare system. And now we will introduce you the steps which were undertaken by the Kazakh government to implement the universal healthcare system that can be also used in our government as well.
The first step is social health-based, insurance-based system. This system comes from contributions from self-employed interpreters, governments, workers. The contributions made, all contributions are pooled and services are provided only to those who need them, increase the extent of repayment and reduce recurs on auto-payment.
The second step is the creation of the Quality Control Committee, or such as the Committee for Healthcare Quality Control. The main function of WIC is to identify where the health services are inadequate and to take some measures for their improvements. Usually those measures are predetermined by this program.
Here we have some problems that need to be solved. The first one is uneven distribution of doctors in hospitals of Kyrgyzstan. To solve this problem, we have decided to make quotas. With the help of these quotas, we will be able to spread people in different hospitals in all regions of Kyrgyzstan, so that there will be no difference. For example, many people working in Bishkek and very few people working in regions of Kyrgyzstan. The second problem that we have discovered is the poor sanitary and epidemiological activities that they have in Kyrgyzstan. In order to solve this problem, we have decided to implement services for quality control. So with the help of these services for quality control, we will be able to control the entire situation in hospitals. We will be able to control the services provided by our doctors, and even more, if doctors know that they are controlled, the someone looks at the quality of service they provide, they will work better. And the last problem we have identified is low level of wages and lack of equipment. So we have decided to solve this problem with the help of implementation of social health insurance-based system. So with the help of this system, we'll be able not only to increase the salaries of our doctors, but also to provide them with better equipment, which would motivate them to work better and to provide better services to their customers, to people living in Kyrgyzstan.
It's all good as knowing all the suggestions, but what about doctors? Are they happy about it?
Yeah, they're very happy.
I don't believe you.
Don't believe it, just watch.